Hey all, Dr. Ray here from Chiropractic Plus. And I want to talk to you about childhood infections. Now, isn't this interesting? Okay. If you take antibiotics, you give a kid antibiotics for acute otitis media, which is an ear infection, the recurrence rate within 1 year is approximately 43%. So there's like almost half, we're going to say half, 50-50 chance, a flip of a coin, that the infection is going to come back. Now, compare that to a chiropractic study that was done where they had a recurrence rate of about 15%, and that took an entire year. Isn't that crazy? Now, how can that possibly be? Well, Dr. Guttman, who is a researcher, he looked at 1,000 children, 1,000 infants, and he was checking the top bone, the atlas bone in the head, and that connects directly to the ear. And he found that the misalignment of the spine decreased the connection to the ear, so the ear couldn't talk to the brain couldn't activate the immune system, and they got acute otitis media, or an ear infection. Now, if you take antibiotics to fix the infection, why it kills the bugs, it didn't fix the reason why they got sick in the first place, and that was because the body was compromised. Now, that could be true of ear infections or just about anything. So the idea is we've got to keep the body connected. And so that way, if you got a connection between an ear and a brain and the immune system, you don't get the ear infection recurrence rate you do with taking antibiotics, because you're simply treating the symptom of the ear infection. And then the minute you kill the bacteria, the strongest one always grows back. Now you need a stronger and stronger and stronger antibiotic to take care of that potential infection. So the bottom line is, guys, that's why kids need care. And my vision was always, let's start with the children. If I can get the children healthy when they're young, keep them young or keep them healthy as teenagers, then they become adults, they start having children, and the cycle would just perpetuate itself. But it never seems to come to fruition. And I don't know why. Perhaps it's because I'm not educating you enough, and that's why I'm doing these videos. Because I think it's so important you understand that, should you bring a kid in for an ear infection? Absolutely. The science justifies it. Bring him in, let's get him adjusted. But I don't want you to wait for the symptom. It's like waiting for the cavity, or waiting for the cancer, or waiting for whatever it might be. Let's not wait. Let's be proactive in our health. Let's step forward in health. Instead of reacting and showing up when we express the symptoms, let's get ahead of the game. Keep, stay, and maintain optimal health for a lifetime. All right? So thanks for listening. Take care, guys. Have a great day.